There is no time left, the words of an Australian epidemiologist who believes certain Melbourne neighbourhoods need to be barricaded in to stop the spread of COVID-19. There's been 64 new cases of the coronavirus in the state of Victoria today. That's down from 75 yesterday. The new wave of cases is mostly concentrated in 10 suburbs in Melbourne's north, west and southeast. Health authorities are aiming to carry out 100,000 tests there in 10 days. Professor Mary Louise McLaws is an epidemiologist at the University of New South Wales and is a member of the WHO's Health Emergencies Expert Advisory Panel for COVID-19. She says it's time to ring-fence the suburbs with high infection rates to stop the virus spreading.
The ring fence is barricading the entrance and exit to that hotspot, and it's very visually challenging. So it has to be accompanied by a lot of ethics and care. They have to talk to the community and explain that the numbers have got so large that it's not just increasing exponentially, it could be hyperbolic, and they need to do something. But while they're doing it, they're not placing those that are negative, COVID negative, at risk. So they need to tell them, when you're walking around your suburb, you're allowed to walk around, go shopping in your suburb if you can, if they have shops, but you have to wear a mask. And then you go home. If you're sick, you have to tell the authorities so that they come and test you.
And if you test positive, Mary Louise, if you test positive in a locked down suburb, would you then be removed from that suburb to a quarantine facility?
Look, when you find a positive case, you have to decide, are you putting the rest of the family at risk of becoming a family cluster? And then it continues. So there is the potential for cases to be moved into a purpose-built environment or another hotel for just cases. Certainly, negative people shouldn't be in that hotel or in that facility at all.
And is that a model that you advocate?
It's a model that has been very successful. When we looked at the response to SARS in Beijing, we, myself and some epidemiologists from Beijing Health Bureau, came to the decision that had Beijing been ring-fenced, we might have changed the course of action. And those epidemiologists were then tasked in 2019 and early 2020 to deal with Wuhan. So they ring-fenced all of Wuhan. And then when they got the numbers down and they released the restrictions and numbers grew a touch to the level of them being anxious, they then put in ring fencing in specific areas where they had been testing and they knew that there was a potential for a great spread again. And so it has been highly successful. The only time it's not successful is when people want to travel back home, like countries like Northern Italy or India, when people think, well, I'm going to be locked in a state and I need to get home. So that becomes problematic for several reasons in that those travellers may be placing the epidemic where they intend to their destination. It could be worse for them. So it has to be managed very well.
Today, the EU has said that it's going to sign up a number of countries that it's happy to have visitors from, and included in those groups are Australia and New Zealand. Would you be happy for people to be travelling back and forth to EU countries as the situation currently is and returning to states like Victoria and Queensland?
No, just in an emphatic no. New Zealand and Australia have been working very hard to get the numbers down. New Zealand has been aiming at zero. Sadly, we've been told we're not aiming at zero, but aiming to a sustainable level, which can be very dangerous, as we've seen in Victoria. So if Australians were to hop on an aeroplane and go to Sweden they have an enormous risk of acquiring infection there because they haven't put in place any definite social distancing and mask use. And while Germany and Austria have been identified as countries that have done fairly well, they haven't done as well as our Asian neighbours. Their numbers of infections per million are over 1,000 and less than, say, 3,000 or 4,000. It's nothing to be overly proud about. They've still got active cases. So I wouldn't be very excited about Australians going there. I'd be worried about them coming back infected. And, of course, they'd have to go through quarantine again. And then, of course, they place the quarantine staff because they're not as well trained. They're not professional like hospital staff for infection prevention, and we're placing them at risk again, and then that spills into the community.
How do you feel about a Trans-Tasman bubble then, New Zealanders and Australians travelling freely between the countries?
I think it's a great idea, and I think that we should be coming together as cousins, identifying that we're in the same headspace for removing as many infections as possible, and having the same approach. And of course, when there are outbreaks, to ring fence them so we're not placing any of your population with vulnerable health needs at risk, and vice versa.
Are we ready to go with that now, though, Mary Louise? Could we go for it now?
In most states and territories in Australia, the answer is possibly yes. In New South Wales, we still have a low background of, particularly over 14 days, of infections, but it's very, very small. And in the other states, other than Victoria, they're either close to zero for 14 days or have been at zero for a long time. So I think it's very reasonable. But the countries need to be prepared for when, of course, they're asked not to. Or, I mean, there has been the suggestion of an immunity passport. Now, that has problems. An immunity passport means you've had a test, you've either positive, and therefore people assume you're going to be not at risk, at least for a number of months. The other idea of an immunity passport is to have a saliva test a couple of days before you leave to flush out any travellers that are going to develop infection in the next couple of days. It's got a very good accuracy level, not the same as a diagnostic one, but that's a possibility. But I think with the numbers so low at the moment, I think that we could open up the Trans-Tasman bubble.
Can you tell me, the idea has been suggested here today that people who can prove they are COVID negative should not have to quarantine. Is it actually possible and practical to do that, to prove you are COVID negative?
Well, some of these tests, like the saliva test and even the swab test, can give you false negatives. So I don't believe that the accuracy of a test is such that if you get tested negative, you can say, oh, I'm going home now. I believe that it's too dangerous and that you really do need to stay in isolation if you're travelling to, say, Asia or Europe. Travelling between Australia and New Zealand, if we have the same epidemiology, the same number, it could be considered that we're travelling between states and territories. But we'd have to ensure that we are keeping a very close eye on our screening of any hotspots. It's a hard question, particularly with the Trans-Tasman one, but I'd suggest that we may not need to prove that we're negative if we're travelling, because we don't need to do that if we're going to travel to interstate at the moment.
When it comes to Victoria, do they need to act today and lock off some of these areas right now?
Yes. They have no more time. So they've had, over the last 14 days, 386 cases. And previously, in the last 14-day rolling average, it was 79. They have no more time to wait. So as an epidemiologist, I would have been doing ring fencing at least a week ago.